I'm going to go over a case today that I did, which is really a great service to the patient. This patient came in on our 24/7 emergency service that we offer here at the Essential Dentist, and we got her out of pain. She had a lower right tooth that had deep decay inside the tooth that had gotten into where the nerve in the center part of the tooth is, had killed this tissue inside there. Bacteria started growing in there, and an abscess was formed down at the bottom. So we were able to do this emergency appointment where we were able to remove that dead and dying tissue inside the canals, the root canals of her tooth, reduce the bacteria count, and her pain was relieved in a very short time. Most people that have an abscess below their tooth, once you get the source of the bacteria out of the canals of the tooth, the body's immune system naturally starts healing things up and removes the pain. We had her come back on another day where we could finish her root canal from start to finish and do a crown in the same visit. One of the things you'll see it is the Essential Dentist is that we do root canals all completed and the crown on the same day. So there's no temporaries, there's no annoying second appointments or anything like that. In about 2.5 hours, we can do a molar, root canal, crown, and build up completed all in one day. It's really a great service for those people that are very busy and have a lot of things going on in their lives. So in this case, I'll show you kind of an example of what we did here. So this patient has a temporary in their tooth from the procedure a couple of nights before. I'm using that special anesthetic system that we have at our office called the QuickSleeper. The QuickSleeper is amazing. It's a completely painless anesthetic system that we use to be able to get teeth numb. So it's also instant and it gets the patient comfortably numb so I can proceed with the root canal procedure. The root canal is quite a complex thing. There are very few general dentists that can actually do a good root canal, one that's successful and will last the patient a lifetime. Most of them are not trained, they don't have enough time or the right equipment to be able to completely do a root canal the way it's supposed to be done. So at our office, Dr. Richard Anderson, I am trained to be able to do these really well. I have a very high success rate on root canals, and I also use not Western allopathic means to be able to clean the canals up, but I use essential oils and other natural healing methods to be able to do root canals successfully. So what I do in a root canal is first we access the tooth. We go down in, we find the canals, and we use these special files to go down in and clean and shape the inside part of the canal. The technique that I have at my office uses this special equipment that uses what's called an apex locator when the file goes down in. So I know exactly how deep we need to go. It measures that with an accuracy within 1/2 of a millimeter or even a fraction of a millimeter. A successful root canal depends on cleaning the canal out all the way to the apex of the tooth. So the special piece of equipment that I have, which is called an apex locator, allows me to go down inside and find exactly how deep my files need to go. So I go down in, clean using rotary instruments, which are very safe. They rotate back and forth and remove the dead and dying tissue in there and widen the canal so I can later fill that with a substance that's going to heal the area. So I go down in, spend quite a bit of time using these little files to go down in and clean out this dead and dying tissue. After the dead and dying tissue is taken out, the bacteria is taken out with these files, we go down in, we spend a lot of time. And this is the difference between most general dentists and endodontic specialists. Endodontic specialists like myself, I spend a lot of time focusing on getting those canals and the microtubules that are inside the canals very, very clean. I use 4 different substances in my office using an ultrasonic cleaner to be able to clean out inside those little canals that are down in there's little tubules that are down inside the canals. I use 4 different substances in my office. and I spend 60 seconds with each substance to clean out the bacteria and make sure that these are absolutely sterile down in there before we ever fill the canals afterward. First, I use sodium hypochlorite. I go down in and dissolve organic tissue. Then I use something called Triton, which has sodium hypochlorite in it, also has chlorhexidine, which is an antibacterial or an antibiotic. It also has something called EDTA, which is an acid which opens up those microtubules so you can be able to clean them out. After that, I go in and I put ozone water down in there and ultrasonically vibrate ozone in there. Ozone kills bacteria, viruses, and also reduces inflammation. Then lastly, I use a special essential oil blend made by the company doTERRA, which is called On Guard. It has wild orange, clove, eucalyptus, rosemary, and cinnamon, all of which are antibacterial or anti-inflammatory. And this acts as a substantive rinsing or cleaning that has lasting effect over a long period of time. Then I go in at the very end and seal everything down to the very apex using essential oil blend with a calcium hydroxide paste and a special type of rubbery substance that seals three-dimensionally inside the canal and pushes that essential oil blend into all the microtubules using a hydrostatic pressure, and the canal is sealed all the way down the apex. All the canals inside or microtubules are sealed inside, and we have a very successful root canal after that. After that, we go in and use our CEREC machine just like we have done in the past. Now, one of the things you'll notice with this, when I'm doing this CEREC restoration, I'm not doing a traditional crown prep where I grind down all of the tooth structure. What I'm doing is I'm saving as much tooth structure as I can, building a strong restoration that's one solid piece that goes down over the crown and fits down in the access hole of the root canal. I'm using the CEREC machine to design this, doing scans first, designing the software to fit the crown or fit the tooth exactly. Then I'm milling that crown in the machine, in the milling unit, and then I'm taking that crown, polishing it or custom staining it, and then cementing it down inside so it forms a chemical bond with the natural tooth structure and the crown itself. So it really works well. It's a really great service for the patient to have this done in one visit. A typical dental office would normally spend 1 or 2 visits doing a root canal procedure, which may not be done correctly, unfortunately, and then they would make a temporary. The tooth could break or the temporary could come off, and chaos could happen in between there. And then they would come back with a lab fabricated crown that may or may not fit and may not look the way they want it to. So we can condense it into one visit, customized and done all naturally in a way that does not create problems for the patient's overall body. Come to the Essential Dentist. If you need to have a root canal or a crown done in one visit, this is the place you need to come. We love to take care of our patients and take care of them naturally using essential oils. Thanks for your time.